More and more patients with hectic lifestyles are seeking an improvement in their appearance. These patients seek out non-invasive cosmetic procedures to enhance their looks. Today we have Brian here. Brian, would you like to share with us some of your areas of concern?
Yeah, the folds from the bottom of my nose down are of great concern, the flatness in my cheeks, and the wrinkles across my forehead also.
It's important that the surgeon have an aesthetic sense of what the patient wants to achieve. Brian, though he wants to eradicate the lines across the forehead, still wants to maintain a very manly look, and so it would be inappropriate to give him a high arched brow. In terms of the flatness of his cheek, we can easily restore that with what we call facial fillers, as well as eradicating the deep fold at the base of the nose. And so, as we approach this, it's important to outline the areas to be corrected, which, as Brian mentioned, is his cheek, the deep fold at the base of the nose, as well as the lines across the forehead, which will be addressed with BOTOX. All these procedures are performed with a little bit of local anesthetic in order to enhance patient comfort. That the surgeon have an aesthetic sense of what the patient wants to achieve. Brian is mainly concerned with the lines across his forehead as well as the deep furrows between the brows. Today we will correct that with BOTOX cosmetic. BOTOX is injected across the forehead as well as in the deep furrows between the brows to give a more relaxed appearance. Brian will see the effects of this in approximately 5 to 7 days, and it will last for approximately 3 to 4 months. We will address the deep fold from the base of the nose to the corner of the mouth. All this area has been anesthetized, so Brian feels nothing. It's important to have an aesthetic sense of the patient's facial shape. I would not want to give Brian full cheeks out here because that was not his original look in youth. Softening of the fold should seem natural, and flow with the overall shape of the face. How are you doing, Ron?
I'm just fine.
At the completion of the procedure, it's important that the surgeon mold and shape the final result to be achieved. I will then have the patient take a look at themselves in the mirror to decide if they are pleased with the result. What we have achieved is improved fullness of the cheek, softening of the deep fold at the base of the nose to the corner of the mouth.
All right.
Tell us what you think.
I like that, Dr. Spence. It looks like it took 10 years off.
Good. I'm glad you like your result.
Thanks.